Are you constantly clearing your throat? It's that annoying, frustrating feeling that something is always stuck right there. A lump, or a thick coating of phlegm that no amount of coughing or swallowing can get rid of. It's with you from the moment you wake up to the moment you try to fall asleep. Maybe you've been told it's just allergies and were handed a nasal spray. You might have heard it's post-nasal drip from a cold that never quite went away. You've tried the remedies, you've taken the pills, but that feeling is still there, a constant reminder that something isn't right. It's more than just annoying. It's disruptive. It can make your voice sound gravelly or hoarse, interrupt your conversations, and make you feel self-conscious. You've probably wondered if you're just imagining how bad it is, but let me assure you, you're not. In the next few minutes, we're going to explore a hidden culprit that's often missed by both sufferers and doctors. A stealthy condition that can trigger your body's own defense mechanisms against you. We'll uncover a real reason you might have this persistent phlegm. And more importantly, I'm going to show you how you can finally address it at the source to break the cycle and find lasting relief. Section 1. The problem you know all too well. Let's talk about that feeling, because getting to know it is the first step. That sensation of a lump in your throat has a medical name, globus sensation. But it just feels like a pill that won't go down or a ball of something that is lodged in there. You swallow, and for a split second, it feels like it might have cleared. But then, it's back. The feeling is undeniably real. And for many, it creates a low-level anxiety and a constant physical distraction you just can't shake. Then there's the throat clearing. It becomes a habit, a reflex you do without even thinking. You might do it before you speak, in the middle of a sentence, or when you're just sitting quietly, and it's a harsh action. Forcefully clearing your throat involves slamming your delicate vocal cords together. Do that hundreds of times a day, and it's no surprise your voice becomes hoarse, raspy, and tired. You might find your voice is especially bad in the morning, a gravelly, weak version of itself that slowly gets better as the day goes on, only to repeat the cycle tomorrow. This isn't just a minor irritation. It has real-world consequences. In a professional setting, a constantly cracking or hoarse voice can chip away at your confidence. During a presentation, you're not just focused on your words, you're worrying if your voice will hold up. In social situations, you might feel self-conscious, always needing a glass of water handy and excusing yourself to cough. It's exhausting. And maybe the most frustrating part of all this is the search for answers. Many people go to their doctor and are pointed toward the usual suspects, allergies and post-nasal drip. You're told to take antihistamines or use a steroid nasal spray. For some, that works. But for a huge number of sufferers, it doesn't. You use the spray for weeks, even months, and the phlegm is still there. This is where many people either give up, resigning themselves to a life of throat clearing, or start to worry it's something more serious. They might even be told it's just a habit or that it's all in their head. While stress can make it worse, this is a fundamentally physical problem. The reason those common treatments often fail is that they're targeting the wrong source. They're trying to fix a problem in the nose and sinuses when the real fire might be starting somewhere else entirely. The phlegm you're feeling isn't the disease, it's a symptom, it's a clue. And if we follow that clue, it leads us to a place most people never expect, the stomach. Section 2. The Great Misconception, Why It's Not Just Post-Nasal Drip. To understand where we're going, we need to get clear on the most common explanation you've probably heard, post-nasal drip. It's a real condition, and it's important to know what it is and what it isn't. Your nose and sinuses produce mucus to moisten the air you breathe, trap dust and bacteria, and fight infection. Normally, you swallow about a quart of it every day without even noticing. Post-nasal drip is what happens when your body makes more mucus than usual, or the mucus gets thicker. Now, you can actually feel it trickling down the back of your throat, causing irritation and a cough. What causes this? Most often, it's allergies. When you breathe in pollen, dander, or dust, Your immune system releases histamine, your nasal passages get inflamed, and mucus production goes into overdrive. Infections like a cold or flu do the same thing. So it is completely logical for a doctor to think of post-nasal drip and recommend antihistamines or nasal sprays to calm things down. But here's the key question. What if you've tried all of that and it hasn't worked? What if your allergy tests are negative? What if you use a nasal spray religiously, but the phlegm in your throat stays just as thick and persistent as ever? This is where we have to make a critical distinction. The phlegm from postnasal drip is often described as thinner and more watery, but many people with chronic phlegm describe something different. A thick, sticky, stubborn mucus that feels like it's being generated in the throat itself, not just dripping from above. This is a crucial clue. It suggests the irritation isn't starting in your nose. Think of it like a smoke alarm that keeps going off. Post-nasal drip is like finding burnt toast in the kitchen. You air out the room and the alarm stops. But what if the alarm keeps blaring and there's no burnt toast? Treating for allergies is like frantically waving a towel at the detector. You're looking in the kitchen, but the fire is actually smoldering in the basement. That phlegm in your throat is the smoke alarm. It's a warning sign. And for many people, that mucus isn't the problem. It's a biological solution to a hidden problem. Your body is smart. It has produced that thick layer of phlegm to act as a protective barrier. The real question isn't, how do I get rid of the phlegm? It's, what is my body trying to protect my throat from? And very often, the answer is acid. Section 3, the hidden culprit, unmasking silent reflux, LPR. For so many people with chronic phlegm, the true culprit, that smoldering fire in the basement, is a condition called laryngopharyngeal reflux, or LPR. You may have heard it called silent reflux. It's a specific type of reflux that's different from what most people picture. When you think of acid reflux, you probably think of GERD, gastroesophageal reflux disease, someone clutching their chest with fiery heartburn after a spicy meal. With GERD, stomach acid flows back primarily into the esophagus, which has some built-in defenses. LPR is different. It's often silent because a majority of people who have it done get classic heartburn. So if you've ever thought, it can't be reflux, I never get heartburn, you could still have LPR. With LPR, stomach contents travel all the way up the esophagus and spill into your throat, the pharynx, and your voice box, the larynx. This happens when two muscular gatekeepers aren't working perfectly. The first, the lower esophageal sphincter, LES, is at the bottom of your esophagus. It's meant to clamp shut to keep stomach contents down. The second, the upper esophageal sphincter, UES, is at the top of your esophagus. Its job is to protect your airway. In people with LPR, one or both of these valves can become weak or relaxed, letting stomach contents travel too far up. And here, as the most important part of the puzzle, the tissues in your larynx and pharynx are incredibly delicate. Unlike your stomach or even your esophagus, your voice box has virtually no defense against acid. It's as sensitive as the skin on your eyelid. So what happens when even microscopic droplets of stomach acid, or just as damaging, a digestive enzyme called pepsin, splash onto these unprotected tissues? The body has an immediate defensive reaction, inflammation. The tissues get red, swollen, and irritated. And this is where the phlegm comes from. Faced with a constant chemical assault, your body does something brilliant. It signals the mucus glands in your throat to produce a thick, viscous, protective barrier. That phlegm you feel isn't the disease. It's your body's self-made armor, a shield trying to protect your throat from being burned by acid. Now all the symptoms start to make sense. That lump in the throat sensation? It's caused by the physical presence of thick mucus combined with the swelling and inflammation of the tissues in your voice box. The constant need to clear your throat? That's your body's reflex trying to get rid of the sticky mucus and the irritant causing it. But this creates a vicious cycle. Throat clearing causes more irritation, which signals the body to make more mucus. That hoarse, gravelly voice, especially in the morning? It's from stomach acid pooling around your vocal cords all night while you're lying down, causing inflammation. Your vocal cords get swollen and can't vibrate cleanly. The reflux doesn't even have to be liquid. In many LPR cases, it's a fine mist or aerosol, like steam from a kettle. You'd never feel it as a splash, but this vapor is still highly acidic and full of pepsin, and it's more than enough to cause serious irritation over time. This is why it is so sneaky and why so many people suffer for years without the right diagnosis. They're fighting the phlegm, never realizing it's a defense against a silent acidic assault. Section 4. What causes the faulty valve? The true root causes of LPR. Realizing that silent reflux could be causing your phlegm is a huge breakthrough, but we can go deeper. To truly solve the problem, we have to ask, why is the reflux happening in the first place? Why aren't those muscular valves doing their job? Often, their function is compromised by our diet and lifestyle. This is the root of the root cause. Let's start with the most powerful factor: what and how we eat. Certain foods are notorious for relaxing the lower esophageal sphincter, LES, that main door between your stomach and esophagus. The biggest culprits include caffeine, alcohol, chocolate, and peppermint. When you consume these, you're essentially telling that door to relax, making it easier for acid to creep out. Next are foods that increase stomach acid or slow down digestion. Spicy, fatty, and fried foods are at the top of this list. They sit in your stomach longer, building up pressure that pushes against the valve. Highly acidic foods like tomatoes, citrus fruits, and vinegar-based dressings add even more acid to the mix. Carbonated drinks are a double whammy. Not only are many acidic and caffeinated, but the carbonation itself creates gas and pressure in the stomach. When you burp to release that gas, it can carry a fine mist of acid and pepsin straight up into your throat. If you notice your throat clearing gets worse after a soda, this is exactly why. Beyond what you eat, how and when you eat are arguably even more important. Eating large meals is simple physics. Overloading your stomach increases internal pressure, which can force the LES open. But the single most impactful habit that contributes to LPR is eating close to bedtime. When you're upright, gravity is your friend, keeping everything down. The moment you lie down flat, you lose that advantage. If your stomach is still digesting, its contents can pool against the LES and flow right out, like water from a tipped glass. That acid can then sit in your throat for hours while you sleep, continuously bathing your larynx in irritants. This is why morning hoarseness and that thick phlegm feeling are hallmark signs of LPR. Lifestyle factors also play a huge role. Excess weight, especially around the abdomen, puts constant external pressure on the stomach, making it harder for the valve to stay shut. Even wearing tight clothing can do the same thing. Finally, there's the powerful mind-gut connection. Stress and anxiety are potent reflux triggers. Stress hormones can increase acid production and make the nerves in your throat hypersensitive. An amount of reflux that you might not notice on a calm day can feel intensely irritating when you're stressed, creating a feedback loop. Reflux causes symptoms, you stress about the symptoms, and the stress makes the reflux and symptoms even worse. These are the specific, identifiable triggers that could be behind your faulty valves. By understanding them, you can see that you have a significant amount of control over this condition. Section 5. The other accomplice: how allergies and irritants fuel the fire. While silent reflux is a major hidden culprit, it often doesn't work alone. It frequently has an accomplice that makes the situation much worse: environmental allergies and irritants. This is why things can get so confusing. You might have been told you have allergies, and it might even be partly true. But it's the combination of allergies and LPR that can create a perfect storm of chronic phlegm. Imagine your throat is already on high alert from silent reflux. The tissues are inflamed, sensitive, and coated in protective mucus. Now introduce an allergen like pollen or dust, An allergic reaction triggers its own inflammatory response and a wave of mucus production, mainly as post-nasal drip. When that allergy-induced drip hits the already acid-damaged tissues of your throat, the reaction is magnified. A throat that could normally handle some post-nasal drip now sees it as another major attack. This double whammy effect sends your body's mucus production into hyperdrive. You're getting it from both ends. Thick, defensive mucus from below in response to acid, and thinner, allergic mucus dripping from above. The two can mix, creating an even more uncomfortable layer of phlegm. This explains why your symptoms might flare up during allergy season. It's not that the LPR went away, it's that your allergies piled on top of it. It also explains why antihistamines might give you a little relief, but don't solve the problem completely. They might reduce the post-nasal drip, but do nothing to stop the underlying acid irritation. Beyond classic allergens, we also have to consider everyday irritants like smoke, strong fragrances, and airborne chemicals. A throat that has been made raw and sensitive by LPR will have a much lower tolerance for these things. You might find yourself coughing the moment you walk down the cleaning aisle at the store. This isn't you being overly sensitive. It's a direct physiological response from your compromised throat tissue. Even dry indoor air, especially in winter, can dehydrate your throat's mucous membranes. This can make existing mucus thicker and stickier, creating more discomfort and a greater urge to clear your throat. Recognizing these accomplices is a vital part of the solution. Your path to relief involves not only stopping the acid from below, but also minimizing the irritation coming from the world around you. Section 6. The path to relief. Actionable solutions that work. We've journeyed from the frustrating symptom to the hidden culprit and its root causes. Now we arrive at the most important part, the solution. This isn't about a single magic pill, but a systematic approach to calm the irritation, stop the reflux, and allow your body to heal. Phase 1. Immediate symptom management and protection. First, let's get you some immediate relief and start protecting your throat. Hydrate, hydrate, hydrate. This is the simplest, most effective first step. Drinking plenty of water thins the mucus. Thicker phlegm feels like a lump, but thinner mucus is less irritating and easier for your body to manage. Aim for 6 to 8 glasses of water a day. Use a humidifier. Dry air is an irritant. Using a cool mist humidifier in your bedroom at night adds moisture to the air, which can dramatically reduce morning hoarseness and that feeling of caked-on phlegm when you wake up. The gentle throat clear, that forceful ahem, is incredibly traumatic for your vocal cords. You need to retrain this reflex. Instead, try a silent cough, a sharp puff of air without the vocal vibration. Even better is the sip and swallow technique. When you feel the urge, take a small sip of water and perform a hard swallow. Breaking the harsh throat-clearing habit is essential for healing. Consider alkaline water. There's growing evidence that LPR involves an enzyme called pepsin, which is activated by acid. Some in vitro studies suggest that drinking alkaline water with a pH over 8.0 may help neutralize acid and, more importantly, wash away and inactivate pepsin lodged in your throat. While the evidence is still preliminary and it's not considered a cure, many people find sipping alkaline water helps soothe irritation. Phase 2. Addressing the root cause, the LPR protocol. This is where we go after the reflux itself. These lifestyle changes are often more powerful than any medication for LPR. The 3-hour rule, your golden rule. This is the single most important change you can make. Stop eating and drinking anything but water for a minimum of 3 hours before you lie down. This gives your stomach time to empty. Going to bed with an empty stomach removes the reservoir of acid that can reflux during the night. If you only do one thing, make it this: the dietary overhaul. You need to become a detective for your trigger foods. For 2 to 4 weeks, try strictly removing the common culprits: caffeine, alcohol, carbonation, chocolate, spicy foods, fried fatty foods, tomatoes, citrus, and mint. If your symptoms improve, you can slowly reintroduce foods one by one to see what your body can tolerate. Eat small, eat often. Instead of 3 large meals, try 5 or 6 smaller ones. This prevents your stomach from getting too full, which reduces the pressure that can force your LES valve open. Elevate your sleep. Gravity is your friend at night. But just stacking pillows is the wrong way to do it. This can kink your neck and increase pressure. You need to elevate the entire head of your bed by 6 to 8 inches with blocks, or even better, use a wedge pillow that elevates your entire torso. This creates a slope that makes it physically harder for acid to travel uphill. Lifestyle integrity. These other factors are crucial. If you smoke, it's a direct antagonist to your healing. Wear looser clothing around your waist, and start to integrate stress management into your daily routine. A short walk, deep breathing, or meditation can calm your entire system, including your gut. Phase 3. When to see a doctor. While this protocol is powerful, it's vital to work with a healthcare professional. Get a proper diagnosis. If you suspect LPR, the best specialist to see is an otolaryngologist or an ear, nose, and throat (ENT) doctor. They can perform a simple in-office procedure called a laryngoscopy, where a tiny camera is passed through your nose to look directly at your voice box. They can see the telltale signs of reflux irritation, redness, and swelling, and confirm the diagnosis. Discuss medication strategically. Medications like proton pump inhibitors, PPIs, are often less effective for LPR when used alone compared to GERD, because LPR can also be caused by non-acidic reflux and the pepsin enzyme. However, they can be a useful temporary tool to reduce the acid in whatever is refluxing, giving your throat a chance to heal while you implement lifestyle changes. Alginates, which create a foam barrier on top of stomach contents, are another option to discuss with your doctor. Rule out other conditions. It's important to remember that while LPR is a very common cause of chronic phlegm, there are other possibilities, including chronic lung conditions or unresolved infections. A thorough evaluation by a doctor can ensure you have the right diagnosis. If you've been struggling with persistent phlegm for months or even years, I hope this has been a moment of clarity. That frustrating feeling in your throat isn't just a random annoyance, and it's not all in your head. It is often a logical, protective response from your body to a hidden irritant. And in so many cases, that irritant is silent reflux. The phlegm is not the enemy, it's the messenger. You now have the knowledge to understand the why behind your symptoms and a clear, actionable roadmap to address the root cause. This journey requires patience and consistency. It took time for this irritation to develop, and it will take time to heal. But by using these strategies, you're no longer just fighting a symptom. You're fundamentally changing your body's environment to one of healing and balance. You are not alone in this. Share your experience in the comments below. What was your biggest aha moment? What's the one change you're going to commit to trying first? Reading through the experiences of others can be incredibly validating. If this has given you a new perspective on your health, please consider subscribing. We'll be exploring many more topics to help you understand your body and take control of your well-being. Be patient with yourself, be consistent with the protocol, and you can find relief.